Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey Angelique, how are you doing?
I'm doing pretty good today, Toby. How are you doing?
Everything's going pretty well with me. I was going to start off asking you a really practical clinical question. Do you mind?
Sure, go for it. A little scared,
Uh,
but let's go.
okay. I think this is not a scary one. What do you wear in clinic and why?
Oh, I wear scrubs,
Mm.
and I like scrubs for multiple reasons. One is it helps me transition from my role as a human being, person, mother, all the things I do at home, into being a professional. It's like, putting on a uniform. And the other piece that I like about it is that I'm not at all worried if it gets gross. So if I end up
Mm.
getting balms or salves or something gross on me, it doesn't matter. I'm not really worried or thinking about my clothing at all. And there's no decision. It's one less thing to
Mm.
have to decide in a day. I have several sets of black scrubs, and I just grab a set and go in the morning. So it's easy in that way as well.
What about for your patients?
I think it helps in a medical profession to wear medical appearing garb, but I only have the experience of having been a nurse working in hospitals and in home care where scrubs were a requirement. They weren't optional.
Mm.
So I think that's also a part of my comfort level with it, is that it's something I've worn for a very, very long time. And so in a medical professional role, it's comfortable. But I think that patients equate scrubs and medicine and security, as long as they don't have some kind of medical trauma attached to scrubs. I think that could go the other way, although I haven't encountered that yet, but it's possible.
Okay. Yeah, I think it's so interesting how we present ourselves, right? Because we don't have a long-standing role in this culture, right? Acupuncturists. So it's fascinating. I've worked with so many different
Hmm.
acupuncturists, right? From shorts and tivas, right, to like shirt and tie with a white coat and things like that. So I just always think it's really interesting
Hmm.
how acupuncturists dress because we don't have a full dress code that we're expected to have, and then the reasons for it. So, anyways, thanks for sharing that. I think that's really interesting. That's a good reason for scrubs for me. That's a good argument because I don't like to think about what I'm going to wear. So that's I'll consider going in that direction. All right. What about your clinical work right now? Any especially outstanding challenges or successes with your clinical work?
I'm trying to think. I don't think I have anything super remarkable in terms of remarkable cases, successes, failures. Nothing is coming up for me at this particular time. I've had a lot of orthopedic cases lately, and those are admittedly not my favorite. But it actually reminds me of a question that I wanted to ask you about Som and pain,
Hmm.
which is I have shied away from treating pain with Som. I was treating a woman that had knee pain with good effect for a couple of weeks, and then it seemed to stop working. So I'm going to take the blame and the hit here. It was probably a misdiagnosis issue, perhaps, but it just seemed to kind of wear off. And so and then they had the case that I talked about a few episodes ago with the carpal tunnels issue where the fist, she couldn't make a fist after I did wrong. I did the treatment on the channel that I shouldn't have, but found out it was the wrong channel through doing the treatment and then reversed it and it got a little bit better. So I've kind of shied away and I've stuck to the orthopedic style needling I learned in school as well as traditional Chinese medicine style acupuncture. So I'm curious how you approach, like if someone comes into you and has, they've sprained their ankle or they have shoulder pain, how you approach it with some and how your efficacy has been versus going in like directly needling into the joints, etc.
Yeah, I still use the framework that my teacher provided, right? Sometimes channel, sometimes quality. So let's say sprained ankle, right? If it's swollen, if it's hot, those are the qualities, and then all the channel trajectories and the counterbalancing channels that are going through the ankle. I tend to have the patient wherever the most pain is. I like to have them trace it wherever over wherever the pain is, and that helps me to I tend to, for pain cases, to focus on the patient telling me exactly where the most pain is. That's where I like to start if I take a channel trajectory. So basically for treating ankle pain, we probably have 8 different channels that we can choose from based on the channel trajectory and the qualities through there. So
Yeah.
I always just base that. I want to ask you about for that pain that was helping with the knee pain, and then it started to not work. Were
hmm
you rotating different channels and it still didn't work, or were you tending to do the same things?
I was rotating. So this
Mm.
person had medial knee pain, and so I was kind of going. I went back and forth between the liver and the spleen. And then one day she had more lateral knee pain, and so it was more on the stomach channel, but didn't seem to last as long as when I used electro. So she was
Mm.
one of my first patients from back in the early aughts of months ago, and I felt really confident about electro and treating knee pain because I did it a bunch in the student clinic at NISA, and so I went right for the electro and had like supremely good results with that. And then I got brave with her, and as I was barking further into the Psalm journey was like, let's try this thing. And it worked great. I think it was like 3 weeks. I think I was able to do each of those channels. I think I did spleen, liver, and stomach, and I'm not sure if I did it in that order. Based on what her other imbalances are, she tends to be a lung excess type person. But it was after whatever the third one was, and I can't remember it. She was kind of like, it
Mm.
didn't really work.
That third one was a new channel you hadn't taken before. Like that's the first time you supplemented stomach.
I think so. I'd have to look back
Okay.
to know for sure.
But usually the problem is then if you keep going to the same thing, definitely it stops working. Usually you were doing the right switching to different channels, but I think maybe you're just missing something. Like if extreme pain, and sometimes even if it's not on the kidney channel, then supplementing small intestine is fantastic for that. If there's a lot of heat involved, supplementing bladder can be really helpful, things like that. So it sounded like you were really focused on the channel part. Maybe if there were some other qualities, do you remember?
The pain as was more of an aching and the medial knee, and it was worse going downstairs. And she liked to walk in the woods, so when she had to traverse roots and things, that was causing her discomfort there. And the knee itself was warm. I remember it being normal color. She runs a little on the pale side, um, kind of puffy in general, is a little
Hmm.
on the puffier side. So with that being said, I did not consider doing. Well, I don't think I could have. Did I supplement? No. Yeah, it was a little on the puffier side. Sorry, I'm being a little tangential because I'm trying to remember if I supplemented large intestine for her ever. Anyway, she was puffy and, but not like edema. Like just she kind of had a puffy quality to her flesh in general.
Hmm.
So the knee itself was kind of puffy. There wasn't anything descript along the medial knee that I could find. It was tender on palpation, like around liver 8. I remember that. And again, around spleen 9.
Before that, you worked with the spleen. Did you supplement large intestine or supplement spleen? Do you remember?
I think I did large intestine for her. I'd have to look back if we're being totally honest.
Yeah.
I know that I worked with those channels. There was the spleen channel, the liver channel, and the large intestine. I'm sorry, the stomach channel. And I know that for the stomach channel, first I did supplement stomach because she's more of a lung excess person. And I can't remember if I think I know I wouldn't have supplemented spleen for her because of how damp on the inside she was. So I think I probably did the large intestine at one point, if I'm thinking back correctly. And then for her, she tends to be more on the Sanjiao excess side versus liver excess side. So I'm almost positive I did a Sanjiao supplementation. But I can't
Okay.
remember which one was effective and which, you know what I mean? I can't go back and remember to be able to clinically discuss this with you. So my apologies there. I should bring my little tablet with me.
Yeah.
So yeah,
And
what are you saying? What are we getting down to here?
I would still recommend, anyways, always whatever is most effective for the patient. That's the top priority for us to do. But from the SOM perspective, right, it's possible supplementing small intestine or supplementing bladder might have been helpful for that. Small intestine to move any kind of blood stasis through there, and bladder to bring that heat
Mm-hmm.
down. Sometimes as we bring down inflammation, that can be a really long-standing effect for pain, especially in the joints.
That makes sense. Would you do bladder even for somebody who tends to run cold constitutionally, like if they were kind of chilly?
Yes, especially in the summer, and especially if the knee itself felt hot.
So when you're evaluating, let's say joints, because people come in with the joint pain. I know with the back you look at kind of what shoe the pain's near, and I've done back pain with some better than I have with joint pain. Do you find basically you just whatever channels are surrounding the joint, you narrow it down to those, and then try to find whichever imbalance fits best, whichever is most out of balance among that collection of channels? Is that your approach generally? Or what do you
Yes.
do?
Yes, and then if the joint feels crazy hot, then sometimes I'll just ignore the channels, right, and then just focus on supplementing UB or maybe even liver, even if it has nothing to do with that joint. If I feel like it's just really warm, that's the grossest thing around the joint pain. Or say there's like a whole bunch of varicosities around it, then I'll kind of ignore whatever else is going on and then supplement the small intestine to deal with any of that blood stasis. So
Okay.
if the quality that's presented in the joint is really gross, then I go for that. Or sometimes the channel the patient will they have no idea about acupuncture channels and they'll trace exactly the channel for where the pain is. They'll say the pain's just
Yeah,
along this channel, and so then for me then that really tips me towards working with the channel, either that channel or the counterbalancing
got
channel
it.
for the one they just traced.
I've had that happen. I often have people to show me like where it hurts and have them do that very same thing with the tracing, and that's been super helpful in that regard. Just be like, oh, of course. Like a lot of people like will trace their gallbladder channel perfectly right down the
Yes.
side of their leg, It's like it runs down here. Thank you so much. It's like a cheat code.
Yes. Yes, I feel like they've studied a textbook just before they came in to show us. But
Yeah,
yeah, I feel like it's really
exactly.
valuable. You and I were talking a little bit offline too about treating monastics, and monastics tend to be able to trace things really clearly on the channel. So we have to take that into account too. They spend so much time in meditation that anything that's going on with their body, they can really tell us in minute detail where it's going on. So sometimes that's really helpful, but also that can be sometimes pull us off. Regular lay people, right? If they trace the channel, fantastic, then that's a good sign. Sometimes monastics, right? No body aware that they can show us exactly the channel. Sometimes with the lower channel coming off it's amazing. So, but anyways, that has a little bit less clinical weight if you end up working with monastics because their body awareness is so high.
So another question that I had for you, Toby, especially now as I'm preparing like to go forward with my raw herbs. Like I've actually got them, I'm starting to grind them. I've got patients asking for herbs. Like I've got four different patients that I can think of right now that very much want to take the raw herbs that I have. And I've been kind of dragging my feet a little bit, if we're being honest, both because I'm a little afraid and because of the amount of work that it's currently taking to get them ready for the raw herb dispensing. I'm curious how do I ask this? How often you use herbs with your patients? Does every patient have an herbal component? Do you use it for a quarter? And how do you decide?
Yeah, I have some basic frameworks that I work. Then I always do like a little bit of flexibility, right? I don't have to follow this, but in general, what I like to do is I like to see a patient for 3 acupuncture visits. Based on how they respond to those 3 visits, then I'll prescribe herbs based on, if they respond really well, but not all the way to a SOM treatment, then I know that they can really hand cool in supplementing blood. Say, for example, I supplement liver, it doesn't resolve everything, then I'll incorporate that into the herbal formula. Or, like, let's say I supplement heart and it really helps, but it doesn't resolve all the way, then that opens up like food formulas for me and things like that. So it's really guiding for me how they respond to acupuncture. I remember during COVID, I was just treating a whole bunch of new patients, and at that time I was only dispensing herbal medicine. I wasn't seeing anybody in the office, and it was at that moment I realized just how much I rely on that, how much I rely on the patient's response to acupuncture to help guide my herbal prescribing. Because again, it's all kind of theoretical till you put those needles in and see how they respond. So normally what I do is I see patients 3 acupuncture visits, and then a lot of times things are resolved. If it's resolved, it's resolved. If not, if there's anything still lingering, then I've seen them partially respond to some of those ideas. So I tend to translate that into classical formulas and then prescribe that. That's my basic idea. So in general, I would do like this: 3 acupuncture visits, herbs for 2 to 3 weeks, and then check back in. I would consider that like a course of treatment, like a standard course of treatment, something like that. Um,
Okay.
yeah. Do you want to ask me any specific questions about that?
Do you use raw herbs? Do you use patents? Do you use both?
Yeah, everything. So I do raw herbs. I use a lot of locally grown Chinese herbs, so I can use that for raw herbs. And then I use those same raw herbs to make tinctures. And then I have a lot of patents. I tend to use a lot of like classical pearls or sunten. That's my main patent ones.
And how frequently are you using the patents? I have found it challenging. I got a stock of patents when I first started because I thought I'll just start there with patents. You know how they had us do that in school. So I was like, yeah. But I was struggling to, I wasn't, I don't know if it's probably just the whole newness of it, but I was having a hard time. Like folks weren't fitting the pattern enough that I felt confident enough to describe a patent. Do you know what I mean?
Yeah, I try to talk patients into raw herb formulas because that I feel like that's we have the most control between swapping herbs in and out and dosage. I feel like we can just put whatever they need. We can put that, if you don't mind a baseball analogy, right across the plate. Right in the strike zone, right? Is fantastic. And then patents, I think about gets into that
Hmm.
ballpark, right? So it's in that area, those ideas, but like a raw herb formula, classically based with modifications, I feel like, wow, we can really dial that in. And then I try to make it so it's enticing for the patients to want to do cook raw herbs. I know it's so much extra effort. So the setup I have at my clinic is when patients first come in, my assistant's assembling herb formulas right there on that table as they come in. So every patient, as they come in the clinic, they often see my assistant making formulas. So I've heard from other colleagues it's hard for them to have people cook raw herb formulas, but especially you come in and you see like 7 trays of these amazing herbs. Almost everyone's curious about that, and they often ask me, "Oh, when can I
Yeah.
get something like that?" So I feel like that's an inadvertent marketing for herbs thing. People coming in and seeing these beautiful, with
Hmm.
some locally grown Chinese herbs, just beautiful formulas being made. They kind of want to get in on the action, so that tends to be really helpful. And sometimes they're even eager to take the raw herb formulas even before I've given the 3 acupuncture treatments. So yeah, that goes well. One other thing that I think really helps with me for doing the raw herbs is I loan out electric cookers so that it basically cooks it for them. So we sign out a herb cooker for them. They cook their formula with it. Whenever they're done with their formula, they bring that cooker back. So that seems to work really well. Displaying the herbs and then giving them a cooker. The compliance seems to be really well. Some patients just will refuse, so that's where the tinctures of the patents come in.
Hmm.
Okay, great. And this is something I know you're just getting started, but just to put in your back pocket, this would be fantastic at some point to get someone to help you out in the clinic. You can do a one-man show for a while, especially getting started. I think it's great, but then consider going forward getting an assistant. It's so valuable to have somebody else take money, make arrangements for the patients, give you a little buffer between the patients too, right? My assistant takes calls in real time, which you almost can never get an acupuncturist on the phone. So my assistant does. If it's something really urgent, she'll come get me even when I'm in the treatment room, so I can answer things right away. So it's really
Hmm.
valuable. Again, nothing to rush towards, but it's really valuable to get an assistant. And then just monetarily too, it's nice because then your assistant could be making up formulas while you're seeing other patients, so it becomes a little bit more affordable, right? If they're actually putting, their raw herbs, you can charge more for knowing what the formula is and putting it together, and then that can offset your cost for having an assistant.
Hmm. Yeah, I would love to have somebody at some point someday. Just how do you go about finding that right person?
Yes.
Yeah.
My method for finding the right person is luck, right? And so trying a whole bunch of other people and then really lucking out on somebody good. My assistant's fantastic. She's been with me now for almost 15 years. She's been fantastic. But I had a lot of assistants that did not work out well before I got this one.
So how long of a trial period did you give people, the ones that did not stick? Like how long did you before you knew that it was like this isn't gonna do it?
I'm not a great manager of other people, so I gave those people way too long time, and it's quite a few major mistakes and major problems. I had one assistant that was more work to manage the assistant than I could have just done everything myself, and that went on for months
Yeah.
before I had to let that person go. I'm not a great manager. That's what I was saying. My method is luck, right? Just finding somebody amazing and just being lucking out on it. Um, in general, if people are thinking about doing this, I think it's great to. There's almost everyone agrees like interviews are useless because you can so easily fool. People can do anything they put an incredible presentation for 45 minutes or however long that interview is for. It's best to bring somebody in temporarily into your office. I did that a little bit before when my assistant just wasn't available. I brought two people in and told them it was just a really temporary thing for one day.
Yeah.
And in that day, I could really tell one was amazing, one needed a lot of help. So then later on, when I needed help, that person that was amazing, I was able to bring back. So I think, yeah, that's a great. It's impossible to know in the interview, but bring somebody in temporarily, and if they work out amazing, then you can hire them full time. If you can manage something like that.
That's solid advice. I've got to make sure that I'm full up enough in terms of patient visits to be able to substantiate it. Let's see, I've hit 26 patients in a week, and now I'm seeing
Fantastic.
closer to 20. So that's good.
Great.
Yeah, it's good.
Uh,
But I think I need to get fuller before I can
yes.
say, let's come on in. Let's hire some help.
Yeah.
I have my son helping me one day a week sometimes, if it's going to be particularly busy, and he does the checking in and checking out and dealing with the money part and cleans the beds, does that kind of thing. And that's helpful just to have that minimal, that little bit of extra breathing room and not having to deal with, treating somebody and then being like, and how would you like to pay today? Having to be
Yes.
the sales person part of it also.
Yeah. I was going to say one other thing too. Just don't forget that for your clinical work, it tends to come in waves like that, right? So like you crested with 26, and then now back to 20, and then it'll go 30, right? And then might even go down to like 13 for a week. That you should expect that. I remember. I spent a lot of my first year or two panicked that I didn't have enough people, and then panicked I had too many people. So just there's going to be ebbs and flows for that. So when you're really busy, try and put stuff aside and not do it, and then knowing that there'll be a little bit of an ebb, and then you'll be able to get all those things done that you were going to do. So. Yeah, try to. Hopefully that's comforting. Nobody told me that, and I was just like, "Oh my God, I'm overwhelmed. Oh my God, no one's coming. Overwhelmed. No one's coming." And it was so those. If you have a typical office, it would be like that. Those kind of waves.
No, I appreciate that. It's nice to hear that that's normal, that things ebb and flow and they come and they go.
Yes.
And you just gotta ride the wave. Yeah, it's so hard to fathom being panicked for having too many patients. Uh, when that day happens, if I'm lucky, you'll be the first to know. Um,
Great.
right now, I'm grateful that I have, enough of a stream of new folks that as other folks complete their course of treatment, there seems to be some replacements. So it's sustainable, it's sustainable at this time where I can pay all my bills and I can pay myself some. And so it's, as long as it maintains and kind of increases, I'll be all right. And that 3 day a
Great.
week schedule, mint. I love that so much. It is so nice to be able to go into work for a clinic day and then give everything that you got and then not have to worry about that for the next day. And so, like, for example, today is my admin day. So I go to yoga class in the morning, and then I come home and I do a bunch of administrative tasks, reconcile insurance and all of that baloney. And then, well, this Tuesday now we're doing this, but then, usually I'll make dinner for my kids. I did that before now. It's a much more relaxed pace. And I know tomorrow, okay, I'm going to go in and I'm going to see a full day of patients. Wednesday seems to be my busier day. So I think I've got 10 patients booked for tomorrow, and I'll go through and I'll do that. And then I have Thursday where I could just be, there's a lot of comfort in knowing that there's rest after, that I don't have to do consecutive days. Like, that's great. Highly recommend.
Again, that's from my teacher, Dr. Wu, that model. I found it amazing for myself. And I don't know any acupuncturists that work like 5 or 6 days a week that are really successful, right? I think it's just too exhausting, this work. You have to chunk it out like that.
Now you see, if other medical professions were that way as well, like if there was more of a break in that way, if things were scheduled for nurses, for example, like, sure, you can do 3 12-hour shifts, but you don't always have agency around when those shifts are. And if they were spread out, it probably would be better. I don't know. I just think if there was more space in general and in the caregiving professions in particular, I think there'd be a lot better outcomes overall for everybody if people weren't having to crank out so many patients per day and having to do it 5 days a week.
Those professions are famous for burnout, right? So obviously it's not working.
Yeah.
But we have
No.
this several millennia
No.
of ideas about self-cultivation and doing things in season. Also, I tend to, like in the summer, see patients much later in the evening, and then I really pull that back in the winter, right? Again, just to reflect Chinese medicine understanding of our energy, right? Much more energy in the summer, so you can go later when it's still bright, everything's nice. Whereas it starts getting dark at 5, where it's really nice to be out of your clinic by then.
I like that. That's also a nice way to do it. I'm going to give that very serious consideration because I stay until 6, and then on Wednesdays sometimes later because I've got a couple of patients that like to come later, and it's okay. Like you said, it's light outside. But when it starts getting dark, it's going to be a drag to be at the clinic because, of course, there's always the breakdown cleanup part. So you're there past, a little ways past your last patient anyway. So leaving the clinic at 7:15 might be a drag in the winter.
The nice thing is you have full control of your schedule too. Again, there's no hospital to negotiate with, right? You can decide, so it's really nice. And again, that I just slowly implemented that, and I loved it because I used to be at the office till 8:30 at night in December, and I hated it. And I thought, I better, since I'm in charge here, I better make things a little bit better. All right, Angelique, anything else you want to discuss today?
I don't think so. Is there anything else that's on your mind in particular?
Yeah, I want to ask you, what are the 2 things that Sun Semiao recommends every practitioner should have?
What are the 2 things that Sun Semiao recommended that every practitioner should have? Oh Lord, I don't know.
He said every practitioner should have a small heart and a large gallbladder.
A small heart and a large gallbladder.
Yes. Why do you say that, Angelique? Do you know much about Chinese culture to know what he was meaning?
No. I could guess, but no.
This fits in well with the Psalm system too, right? So for the large gallbladder, that's courage and decisiveness and being a little bit aggressive in the clinic to really go after things. And then for the Psalm system too, we say someone has a small heart deficient, then they're really cautious. So he felt like practitioners should have these 2 qualities depending upon what's presented in front of you, right? If you're sure and you really got to help that patient, then that gallbladder should come on. If you're so unsure, you got to be really careful and slowly go. Again, case by case, each one of those organs dominates what needs to be done for the patient. So he felt like each practitioner should have those 2 qualities in them.
I like that. That makes sense.
It's really guiding for me. Okay, let's leave it there for now, and I'll put on the screen, if I can figure out how to do it, the email if anyone wants to get in touch with us about anything. Otherwise, I appreciate everyone's time, spending a little bit of time with Angelique and I. Okay, everyone take care, okay? Bye for now.
Yes, good to see everyone. Take care. Bye-bye.